Okay, hi. So let's now just spend a bit of time thinking about iliacus and psoas, iliopsoas, our main strongest hip flexor. Very strong muscle, joins onto the anterior aspect of the lumbar and the iliacus, the inside of the ilium, and comes through, joins onto the lesser trochanter top of the femur. So we know it's our biggest hip flexor. We know that it has a real strong emotional element to it, the muscle of the soul, which is a nice, I think, interesting to play with. This, what do we hold it in ourselves emotionally is always important for us to think about, particularly when we get that story from the client. Where are they in their lives? They're athletes, they're cyclists, or they're just busy gardeners. It's important to get that sense of what are they bringing to us, and us really understanding where they are as individuals. Really important. Number of ways you can work on this, and I think this is always an area that we avoid because it's kind of abdominal, because it's near the genitals, because it's kind of inside that abdominal cavity. We tend to just avoid it, and then there are circumstances when it's really important to. So if you're working with a lady and it's menstrual cycle or abdominal issues or IBS, anything abdominal inflammatory, then obviously that would be something we're very careful about. And if I tend to work, if people don't want me to kind of work in here and start to think about working on that anterior aspect of the ilium, and they find that intrusive, then don't do it. The bit I think that's really important to think about here, that if this muscle is really tight, so Thomas test, we're lifting that leg and the other leg jumps. If we've got that lordosis in the lower back, that pain in our lower rectus spinae group, we got to kind of remember that that's been around for a long time. So setting this up and working with it today, this client needs to go home and restart to think about yoga, start to think about lengthening. 6 months work, 3 months work, seeing us in between what they do. They spent years getting this kind of sore and anteriorly rotated. We got to make sure that we set the stage and encourage them and find them ways in which they can sort of easily start to stretch. And there's lots of things, and I'm not going to cover that today, but there's loads of stuff on YouTube that you can really go to that really helps you think about lengthening the psoas. It's very simple to do, and got to do it every day. So let's get into the bony landmarks. Now, anterior superior iliac spine, iliac crest here with T. You can see I'm just running my fingers on the inside. T and I tend to do this slightly differently, but that's the beauty of our work, isn't it? That there's more than one way to skin a cat. So bringing our thumbs around the ilium and coming on the inside here, just working through, sliding. Again, I don't use very much wax here, just enough to give me a little slip, but not much. And I tend to sort of draw back through those fibres, tucking in, work your way around the iliac crest as much as you can. Certainly the first third, I think you should be able to get quite comfortably underneath. And it's quite nice, to ground yourself here, get yourself in that position so you're really working with my pelvis, not just all thumbs and fingers. Really nice to do. If you're going to go into thinking about soft tissue release, STR, then we can bring this knee, and the client mustn't laugh either. If they laugh, disaster. So you come dropping into that ilium, that anterior aspect of the ilium, pulling through, holding that, locking in. Client then drops their legs, stretching that fascia, that nice link of that muscle. This is very fascial in here, so you've got to really think to yourself, it's not just this muscle sitting on its own, it's interwoven with this deep connective tissue that really kind of links and supports everything in place. So off we go again. So you were showing, before we started filming, a nice rotational thing that you were doing. Was it where you came along?
Yeah, start medially rotated.
So you start medially rotated, and then you come lock in and then come out and then do the stretch. Let's try that. So the foot is out slightly, and the knee is in, so you get that medial rotation in the femur. Here's my ASI, so I drop into that aspect of the iliacus, drop in and just lock. Then you come out. Ooh, yeah, nice, I like that. And then you drop the leg down. Yeah, nice. I like that.
Yeah.
Cool. I like that. Lovely. One of the great things, isn't it, when you work together with other therapists, is that sharing of knowledge and ideas and techniques. Nice to do. Okay, so that's iliacus. Then if we come down, again, there's different ways of doing this. I know that Chi sometimes comes in through the abdominal wall here and works down towards that the spine. I tend to come on the ASIS, coming down a couple of fingers from the ASIS and then coming in just above the inguinal ligament. Just here's the inguinal ligament joining from the pubis across here. So I'm in this above the triangle here of the inguinal ligament, and I can just drop through here. T then brings her leg up. I just come in and just feel that tissue, just let that knee push up. Ooh, yes, sir. And then I can lock into here. Can't see with the camera, but it's one of those things that you feel rather than see. Drop in here, she slides her heel down. Yeah, nice. And I can feel that sort of sliding under my fingers. Just a word of warning, obviously big artery that runs through here. So if you're ever in here and you get a boom, 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 come out. Fairly obvious. Or if you're in this place, that nerve capacity comes through here as well. So if you've got a lot of referring kind of, oh, I don't like that, obviously come out. So be careful with this. But I really advise you to practice it on friends before you do it on clients. Why would we do this? Lower back pain, anterior rotation, localized pain, that whole area. And don't forget that this is a very stressful muscle. It really gives us that ability to open rather than feel closed in. So important one to learn how to do. Don't forget to link it to that story that the client brings to us. There's a lot going on in my life at the moment. My stress levels are 8 out of 10. Good reason to start to work on Psoas. Thank you.